It was first documented nearly 2,500 years ago and originally thought to be a blessing from the gods. It would surface repeatedly throughout human history. Socrates, Julius Caesar, Alexander the Great, Napoleon, Buddha, each was haunted by it. What was first thought to be a sign from the heavens became known as the work of the devil. It is said that everything that could pass through the gullet of man was used to treat it. In some areas of the world, burning the bottoms of the afflicted's feet and exorcism were considered reasonable treatment. It's a chronic neurological disorder where abnormal discharges of nerve cells takes place in the brain. We're talking about epilepsy, a disorder as old as mankind, and yet still misunderstood. Webster's New World Dictionary of the American Language defines epilepsy as a chronic nervous disease characterized by convulsions and unconsciousness. Technically correct, but this definition lacks the sensitivity to the subtle intricacies and nuances that distinguish epilepsy from other acute disorders that have specific causes, specific symptoms, and specific treatment. Dr. Kiffin Penry, often referred to locally as Mr. Epilepsy, has made the subtle intricacies and nuances his life's work and is recognized internationally for his innovation and relentless pursuit of quality epilepsy treatment. He was the recipient of the 1993 American Epilepsy Society Milken Family Medical Foundation Epilepsy Research Award, the Epilepsy Foundation of America's Distinguished Service Award, the Epilepsy Foundation of America's Pierce Bailey Award, just to mention a few. Dr. Penry enjoyed a distinguished record of service as the chief of the epilepsy branch of the National Institute of Neurological and Communicative Disorders and Stroke, and was the subject of an ABC television movie depicting his struggles to get new anti-epileptic drugs approved for use in the United States. Dr. Penry emphasizes that epilepsy is a complex neurological disorder, which is too often approached in the medical community by treating the symptom without understanding the disorder.
It's the fact that epilepsy is so complicated in seizures that it takes a special effort to know all of the nuances and all of the specific types, so that the average neurologist who's trained to treat 600 diseases and disorders of the nervous system is not specialized in epilepsy. The epilepsy is more than just a seizure. And when you do that, then you can treat it much better because you understand the whole mechanism.
Kristen Freshwater is an epileptic. She has a rare type called childhood juvenile absence. Her 10-year struggle with epilepsy is characterized more by her struggle with treatment than with the disorder itself.
I was on the Dilantin for 6 years, and at the end of 6 years, the doctor I was seeing at the time decided that he had misdiagnosed me, and he wanted to place me on a different medication because of the side effects I was having from Dilantin, the gum overgrowth, and he said the bones in my face would start to protrude, and I would have very coarse skin, which he'd never told any of us this before. He didn't tell us till after the 6 years that my IQ scores had lowered, and I was really sluggish during this time, and it was just a really hard time in my life going through adolescence and everything to have all these other side effects happening to me. So he decided that, told my parents, I'm sorry I misdiagnosed her, I'm going to place her on a different medication. He placed me on Tegretol, which Tegretol actually causes people with my type of epilepsy to have grand mal seizures. He told my parents he had misdiagnosed me. He was sorry.
Kristen's case was eventually referred to the Epilepsy Institute of North Carolina. Her epilepsy type was properly diagnosed and treated. She is now seizure-free, and as importantly, she was given back her life. Kristen entered college, enjoyed an active 4 years as a cheerleader, and graduated in the School of Nursing. She is working in a neurological unit of a hospital and works primarily with the treatment of epileptic patients. Kristen Freshwater is not an isolated case. Similar cases of misdiagnosis, incorrect and over-medication are common. Debbie Kincaid had her first seizure at the age of 9. Her pediatrician prescribed medication that left her lethargic with no real hope for a future, until her treatment was referred to the Epilepsy Institute.
Well, it happened several years ago that Debbie was the babysitter, and they noticed they couldn't explain what she had, and they knew something was wrong. So we had her checked by the doctor and found out she'd had a grand mal seizure. So her pediatrician automatically put her on medication. And with Debbie's history, with cerebral palsy, they just automatically said, yeah, this was a seizure, and so they just, I believe most pediatricians, whatever, phenobarbital is the first thing. That's what they're more familiar with because they don't know the other medications and stuff around, But there was no test done, no brain scans, no nothing. Like Dr. Dean's, right off the bat, she knew exactly what test to run, what to look for, and we were involved in the testing and everything, right there with her, and she showed us the spike in activity and everything that, showed up on the test, and she knew right off the bat exactly what direction she was going in, and I think she had a pretty good idea of what she was going to find. After we found out, got more comfortable with what seizures were, why she was having them, and how the medication would interact to it, and control them. Yeah, there's a big outlook on it, big difference. As a matter of fact, when she graduated, all the kids were all in tears, and she was going around hugging each one of them one at a time and telling them goodbye, and they were all crying. They was really gonna miss her.
Beth Bauer is perhaps the case which best demonstrates how tragic the incorrect treatment can be.
Beth Bauer was a young lady in a family that moved here from Fort Wayne, where she had a treatment with multiple drugs and kept having seizures, and they kept adding more drugs onto her, which was a principal practice, still is in some areas where people aren't skilled. And she was on myceline and phenobarb and dilantin. All of those are sedative drugs, but they vary in sedative. Myceline is the worst, phenobarb probably is the second, and dilantin is the least sedative in this way. And so what happened was that she had been sitting around sleeping half the time, having seizures, and couldn't do things.
For Beth Bauer, at the age of 16, the result of the multiple medications left her virtually homebound and without any real contact with the outside world. So even after she was correctly diagnosed and treated, she required extensive personal rehabilitation due to the loss of the formative years of her life.
She had missed pretty much her adolescence and all the things that people do during that 10 years that she was not permitted to do. And essentially in her case, we had to redevelop her personality. Over those 10 years she lost it. She had no self-confidence, and we've encouraged her to come into the real world and live. And she's got to where she's reading books and doing things, and she's essentially tried to make up for 10 lost years.
These stories are not an indictment of other medical practitioners and facilities, but rather a demonstration of the complexity of epilepsy given the differences in seizure types.
We like to say that many people don't know how to recognize these, and they're having what would be generally a seizure, but they don't diagnose a specific type of seizure, and therefore don't treat it appropriately.
The examples of Kristen Freshwater, Debbie Kincaid, and Beth Bauer are real-life demonstrations of the misunderstanding within the medical community regarding the treatment of epilepsy. The creation of the Epilepsy Institute of North Carolina was a response to the problem. It was conceived by Dr. Penry and is operated by Dr. Christine Dean as a safe haven for people suffering from epilepsy, a place where comprehensive analysis of seizures, correct medications, broad-based treatment, and education would lead to control of the disorder and quality of life for epileptic patients.
It takes time to develop the case, and case development, observation, and putting the facts together is the most important thing that we do here. And if you do it right, you directly impact on the patient's quality of life. So many of the seizures, they're all so different, and that's why they need to be studied. And this is exactly what the primary care doctors or the doctors first screening them, they really don't know how to do it, and they don't have the time to do it. And so, one of the things about the Institute is that we can study these. We can dissect them. We can time them. We can, even in some cases of partial seizures, abort them, show the patient how to abort them, teach the patient what the seizure looks like on the camera, on the video, and learn what leads up to that. And because we have a time lock sequence between the visualization of the patient and the EEG, we can see the onset of the seizure by looking at slow waves in the EEG portion. We can time that, and that's a way of educating the patient about the seizure.
Educating patients about their seizures is part of the Institute's philosophy called continuity of care. And this is what sets it apart from other medical treatment of epilepsy. It begins the first time a patient walks through the door. A meeting with the patient and family members begins the process. A total assessment of the patient's history and experiences with seizures is discussed in order to gain a thorough understanding of the situation. The patient's input is vital in completing the puzzle, which leads to the correct diagnosis of each patient's epilepsy type. During subsequent visits, a patient will undergo outpatient monitoring with a video EEG, a revolutionary device pioneered by Dr. Penry. It records a video image of the patient while simultaneously documenting the patient's brainwave activity on an EEG. Outpatient monitoring can take up to 6 hours to complete. The goal is to obtain a clear clinical picture of the seizure and its electroencephalographic correlate. Outpatient monitoring provides an objective account of each patient's seizures and seizure origin. It is indispensable in differentiating seizure types and the diagnosis of seizures from other altered states. When the diagnosis has been made, drug intervention and drug education can begin. Each patient is briefed on the benefits and the side effects of the prescribed drug. Quality of life as well as seizure control are primary considerations when prescribing medication.
They will take what you say at face value because you are the doctor, and this just isn't good enough. You need to have a dialogue in which they become their own doctor. And that's, we ask them at some point, or we let them know that they are to participate in this. It's a process. The process from the door to going out the door completely seizure-free. You're only 1/3 there. Now you've got to keep them seizure-free.
And keeping patients seizure-free requires an active role on the part of the patient. Proper medication, dosing, and scheduling can only be effective with the patient's cooperation. In addition, changes in lifestyle are often recommended. Stress, lack of sleep, alcohol consumption are factors that can often trigger a seizure. So patients are counseled on lifestyle modification that can aid in seizure control. The goal is to provide each patient with the information and techniques they need to keep their lives in balance and to give them the confidence they need to monitor themselves.
A lot of patients that we've had for years are so good at managing their drugs, they actually will call us. They'll call us, instead of coming in, they'll call us. And they'll tell us, well, I didn't attend the appointment last month because I knew what to do. That's the ultimate.
Patient follow-up is the final step in the process. During these sessions, patients will undergo a minor physical exam, including blood testing and EEG. Then they will meet with a doctor to discuss changes in their condition or their lives and how they have adapted in order to remain seizure-free. It's a time to review the patient's progress and discuss anything on the patient's mind.
I think the reason they come here is they know that we know who they are. This is what makes the Institute different. They intermingle so well with each other, even if they don't know each other. They perceive that they're all kind of in the same boat. It's just a very different thing. I never see anyone upset because we took a patient out of turn. I've never seen that here. And yet you see that everywhere else I've been. Everyone seems to understand that the little girl in the wheelchair that's having the seizure gets to go in there, We have no It's like a clinic without walls. It's the strangest thing. We have no barriers. They know they can walk in any time, and they can also call any time.
To be available to patients is vital to their success. For this reason, the Institute also has a nurse clinician on staff to work with patients. The nurse is specifically trained in the treatment of epilepsy and is available at any time to take phone calls from patients with questions or problems. Patients can call 24 hours a day, 7 days a week, and always talk with someone who is familiar with them and their case history. The vision of continuity of care is a reality at the Epilepsy Institute of North Carolina and is unparalleled in the medical community. It's a philosophy driven by ongoing research with new and experimental drugs for the treatment of epilepsy. It's a commitment to self-help by providing support group counseling for patients and families of epileptics. It's a commitment to doctor education, providing continuing education seminars to advance the awareness and treatment of epilepsy within all the medical community. But most of all, it's a philosophy driven by a desire to contribute to the quality of life for epilepsy patients, to provide every opportunity for a productive life filled with confidence and motivation for the future.
My feelings about the Institute is basically they've given me my life back.